Did you know that headaches and migraines can be caused by myofascial trigger points? So you might have heard about trigger points, but maybe not sure what they are or how they're caused. So a trigger point basically is a knot that you can feel in your muscle if you press it. However, they're not formed just from the muscle tissue, but also from the fascia that wraps around and through the soft tissues in the body. So it's a combination of fascia and muscle tissue that can become restricted and cause those knots that you feel. There's different types of trigger points. They can sometimes be latent and they can sometimes be active. So if you press a latent trigger point, it may feel tender where you press it. But if it's an active trigger point, it can cause pain and other symptoms that may be referred to other parts of your body. Very typically for headaches and migraines, the trigger points that cause these or contribute to these are found in the pericranial muscles. What are pericranial muscles? Well, they are the muscles that attach into your face and into your skull. At the back is the muscles that come up from your shoulders into your neck and attach into the back of your skull. And at the front is the muscles that come up through the throat, attach into your jaw, and also in your face that can attach into your jaw as well. So a combination of restrictions in these muscles can cause headaches and migraines. But pain is not the only symptoms that trigger points can cause. They can also cause things like tinnitus, which is ringing in your ears, blurred vision, muscle twitching, disturbed sleep. So one way to help to start to release myofascial trigger points is by doing myofascial stretching. And this helps to start to release the restrictions and undo some of those knots in your pericranial muscles. Here's a couple of exercises to try. They're very simple, they're very slow and progressive, and they can start to help to undo some of those restrictions and hopefully help to reduce the symptoms that you feel with headaches and migraines. In this exercise, we're going to do a stretch for the back of the neck. You can do this exercise seated or standing, whichever is more comfortable for you. To start the exercise, just drop your head forward so your nose is pointing down towards your chest. And just let your head hang heavy and allow the weight of your head to start to create a stretch in the back of your neck. As you do this, just imagining the tissues in your neck starting to relax and lengthen, and the vertebrae, the bones in your neck, starting to space out. Sometimes they can become very compressed, and this can lead to problems with discs in the neck. And that in turn can lead to problems either with headaches or with RSI type symptoms in the arms. So stretching your neck is a really lovely thing to do. And as you're here, just allowing the tissues time to soften and release. And if you like, you can bring 1 or 2 hands up and place them on top of your head. So you're not pulling, you're not trying to force more of a stretch. You're just allowing the weight of your hands and your arms to create a deeper stretch. And as you do this, you might start to notice the effects of the stretch spreading. Sometimes people feel it more coming up into the back of their head and even over the top of the head into their forehead and their eyes. Other people feel it more going down their back, so extending from the neck down into the upper back and even down into the mid or lower back. Whatever you're feeling is absolutely fine for you, and that is the release that your body needs to do. And as long as you're here for at least a couple of minutes, then this allows time for the fascia to start to release and let go. In this exercise, we're going to do a throat stretch. So to do this, you can either do it through clothes or you can do it directly on skin. Sometimes working directly on your skin means that you get better contact and traction. So you can experiment at home to see what works best for you. So you're going to cross your hands, place them on your chest just below your collarbones. So if you imagine the palms of your hands sinking gently through your clothes, through your skin, and making contact with the tissues underneath. So don't worry if you don't actually feel that, but just imagine it, because the more you imagine it, the more it will start to happen. And so you may start to feel that the tissues are a little bit softer under your hands. And you can then start to allow your arms to be a little bit heavy. So as that happens, they'll start to pull slightly down towards the floor. So you're not aiming to move your hands, but you're aiming to get a sense of traction of the tissues in your chest being gently pulled down towards the floor. And from here, you can then tip your head back slowly, only as far as feels comfortable. If this makes you feel dizzy, then keep your head level. And just allowing your throat to start to stretch, and you'll get a sense of stretch that comes up from your collarbones, up through your throat and into the bottom of your jaw. And this is an important area because there are tissues, muscles and fascia here that can get very tight and can restrict the movement of your jaw. So some of the pain that you may get with your jaw and your TMJ can be coming from this area, particularly if you get a sense of restriction in your throat when you swallow. And as you're here, if it feels comfortable, you can turn your head to the side. So if we turn to the right, first of all, and you should feel a stretch start to come up the left side of your neck and your throat into the side of your jaw, just below your ear. And just allow time for that to start to release and let go. And as that feels softer, you can then slowly turn your head to the other side. And again, just allowing time for the tissues to soften and release. And this time you should be feeling the stretch coming up into the right side of your jaw, just underneath your ear. And just allow that to soften and release. So this can really help, particularly if you sometimes have that feeling of restriction when you swallow or when you breathe. And this just helps to open out all the tissues internally in your throat. I hope you found that those exercises were helpful. If you want to find out more about myofascial stretches and exercises, then why not visit our YouTube channel, where you can find loads of videos like these to help with chronic pain conditions.